So I work with a lot of families from all over Australia who come to Sydney Children's Hospital for bone marrow transplants. And we have families from Northern Territory, South Australia, and from rural and metro New South Wales. Some of the main kind of hardships that families face is, number one, the scariness of the prospect of a bone marrow transplant. It's a highly intensive treatment with a lot of risk factors involved, so there's that emotional response. Often then as well, it means a long time away from family. So like whether you're traveling interstate or whether you're having to relocate to Sydney or even spend such a long period of time in hospital, it's that disconnect from your natural support network, your family, siblings, parents, aunts, uncles. It's a very daunting time for both the child and the parent. Also then there's huge disruption in terms of like the practical side of living, in terms of attending school, attending work, income. There's a huge increase in the cost of living because you're not living at home. You might be trying to maintain a household at home and also maintain living up here in Sydney. So you might have increased food costs, increased utility costs, and hugely increased travel costs, particularly for our families who live within 100 kilometres and are travelling back and forth from the hospital. Also as well, it's such a long period, the bone marrow transplant. I mean, on average, you're talking about our patients being in hospital for between 4 to 6 weeks, sometimes longer if there is some complications, and then requiring to be close to the hospital and attending up to 3 times per week in the initial phases after discharge for potentially 6 to 8 weeks again after discharge. And then in that you'll have readmission to hospital, you might have infections, you might have the need for supportive care. So you're talking, as a minimum, it is a 4 to 6 month, very intensive, invasive, disruptive and expensive period for a family.
Thank you so much. And can you tell us how Arrow's helped with these families?
Arrow has been amazing with our families, and I suppose with bone marrow transplant it isn't just for oncology patients. It's also for kids who have immune disorders or rare blood diseases that without it may not survive. And we are one of the centres in Australia, the few centres that do bone marrow transplants. So I have families who come here who have a diagnosis that maybe might not be supported by any other charity organisation, or may not even be recognised in the carers allowance to get that supplementary income. And I've very much depended on Arrow for these families in terms of assistance with travel, with accommodation, with grocery or utilities. So I very much call upon Arrow regularly to help these families, and some families are very much dependent on it and are contacting me wondering when is the next bit of assistance coming through. So I would work very closely with Arrow around supporting these families.